First aid for the TeleMed QESP people. Today we're going to talk about stroke, but first a little introduction, again, on privacy.
Hi there, are you Penelope Waters?
Yes.
Hi, I'm Dr. Allison Crawford. I'm the psychiatrist who's going to be speaking with you today. Nice to meet you. I just want to tell you, I understand this is your first time meeting with somebody by televideo, so I just want to explain a few things about the process. One of the first things we do is always make sure that we're speaking to the right person. So you're Penelope Waters?
Yes.
And can you just confirm your date of birth for me?
Yes. September 17th, 1976.
Okay, great. Well, it's a pleasure to speak with you. We always make sure that people understand that although I'm speaking to you by camera, nothing's being recorded right now. And this is just as confidential as if you were in my office with me. So there's no one else in the office with me, and we make sure that no one else can hear what we're speaking about.
Excellent.
Okay, and at the end of our session, I'll be sending a note to your doctor.
Okay, great.
Okay.
Today we're going to talk about stroke, cerebral ischemia, when there's a blockage of flow of the blood to a certain area of the brain.
A stroke can occur when the blood supply to the brain is disrupted and starves the brain of oxygen. Strokes are most commonly caused by a clot that blocks the flow of blood to a part of the brain, although some strokes can be caused by a ruptured blood vessel that causes bleeding into the brain. Call 999 or 112 for emergency help immediately.
In America, dial 911, 112 in Europe, and learn the number for your country.
If you suspect someone is having a stroke, you can use the FAST guide to identify the key signs. F stands for facial weakness. Look at their mouth or eye. They may be droopy and can't smile evenly. A, arm weakness. Ask them to raise both their arms. They may only be able to raise one. Can you raise both arms for me, please? S, speech problems. They're unable to speak clearly or might not be able to understand what you're saying to them. Ask them a question such as, what is your name? Can they respond appropriately? Can you tell me your name, please? T, it's time to call 999 or 112 for emergency help and tell them you suspect a stroke after using the FAST guide.
Learn the number in your country. Now let's watch an example of how a stroke might progress.
Yes. But
Yeah? What was that?
I was left man.
You alright? Dave? Dave? Dave, listen, I'm just going to go and get someone, alright? Alright, just give me a minute. Okay, 1 minute.
Dave, right, Jason, can we move this table out, please?
Yeah.
Yeah. Wait, Dave, can you smile for me?
Yeah.
Okay, Dave. I need you to try and lift your arms for me. And this one? Right, can you tell me your name, please?
No.
Okay. Jason, can you just stay with me? I'm going to call for an ambulance.
Dave, it's me, alright?
Yes.
Just gone to get an ambulance, alright?
Sometimes mini strokes can happen, which can actually mean that the small little behaviors. So it isn't always a major stroke.
While waiting for help to arrive, keep them comfortable, supported, and reassure them. Do not give them anything to eat or drink because it may be hard for them to swallow. Keep monitoring their level of response until help arrives. If they become unresponsive, prepare to treat for an unresponsive casualty. So remember, to help someone who has had a stroke, use FAST. Facial weakness, arm weakness, and speech problems means it's time to call 999 or 112 for emergency help. And that's how you help someone who's having a stroke.
Now there are two major types of stroke. The ischemic stroke means there's a blockage inside some artery, so they can't get blood because of a blockage. Usually this is because cholesterol, calcification, aging, all those other different types of things. There's also a hemorrhagic type of stroke where there's a small hemorrhage or bleeding. That's usually because of some type of a trauma, old trauma or new trauma. If there's hemorrhagic type stroke, then we find that cabbage juice is very powerful, has vitamin K in it, and cabbage juice will help to stop any excess bleeding. That's why it helps to cure ulcers. So cabbage juice is good, but only for the hemorrhagic. It's not good for the other type of stroke. Now, if there's an ischemic stroke, we often found that a little bit of aspirin. We don't use the aspirin as a prevention anymore because it creates problems inside the stomach. It creates the ulcers that we need the cabbage juice for. But a little bit of a aspirin at the time of a stroke can help to get that blood going by thinning the blood. And here's a natural formula that helps to thin the blood. Recognize that we don't use alcohol if the person's alcoholic or has been using alcohol regularly, but a small little bit of alcohol at an emergency time of a stroke can help to thin the blood and maybe help to get that blood going. But you'll have better results with the turmeric, cayenne pepper, ginger, cinnamon, very, very powerful cinnamon, and put it in a cup of water, not to try to cause gagging if they're having any type of problem. Here's a couple of acupuncture points that you can press to help the stroke while you're waiting for help. You can also help them to do the cross crawl method, and you can move their arms and legs yourself so that it helps to get establishment of the neurons into the brain. So this is very helpful. Remember, the cross crawl is very helpful. I have had great success with convaleriana, lily of the valley. At the first sign of stroke, or if there's been a stroke, if I can get a small dose of this is a poison in a large amount, but a small amount will help to break up the crusty little areas of the brain. The little crusty areas of the brain will be restored to blood flow with the convaleriana. So it's very, very powerful. Use that formula. Use your machine, use your techniques. Help to wait for emergency people to arrive. Even if it doesn't seem like they can hear you, they can. They're listening. Interact. Help them to relax. Be patient and wait for help.